The title of this talk is Bladder, Bladder, What's the Matter? And the purpose of this talk is to try to reach out and dispel some of the misconceptions out there that many women have about how their bladder functions and what is appropriate and what's not appropriate and what can be done if things aren't working correctly. And I come to you from about a 20-year experience now where we've been running the WomanCare Center for Bladder Control, and that's an offshoot of WomanCare, which is a very large practice in the northwest suburbs that practices obstetrics and gynecology. But this is a subset of WomanCare where Valerie and I'll introduce Valerie to you a little later. She's actually the manager of the center, and she is a board-certified continence care clinician, if you ever doubted that there was one. There is at least one in the city. And she has a wealth of experience, and she's brought that to our center. And we have now been treating women with all kinds of different types of non-invasive and minimally invasive therapy for the past 15 years. And I'm very proud of that because I think we've made a difference in a lot of women's lives. So tonight, I would like to try to explain to you in layman's terms, and I'm going to keep it simple, a little bit about the anatomy and a little bit about the physiology of how the bladder is supposed to function with the rest of your body. All right, so for many of you in this room, and I'd like to see a show of hands actually, when you go into somewhere that you haven't been, this is the first thing you look for. How many? Okay. Because I'm going to tell you that's how I know when women have a problem. I could be sitting in a restaurant with my wife just waiting for my dinner or waiting for my table, and I'll just people watch. And I'll watch women come into the restaurant, and the first thing they're not going up to get their table. They're looking around to make sure they know exactly where that bathroom is, so that if they have to go, they can get there in a hurry. And really, that's how I would say you know that you have a problem. If you have to start thinking about these things so that it's not a part of your routine in your life just to empty your bladder when you feel like you need to, then I think there's a problem. And we're going to go through all the different types of problems that you can have. So urinary incontinence, the unwanted loss of urine, affects 15% of adults, which means approximately 25 million women or people are affected, not women, but mostly women. It encompasses a loss of productivity. Incontinence sufferers can lose 2 hours of productivity each week just going to the bathroom too frequently. Almost 20% of women are forced to stop doing something that they would like to be doing, whether it be exercise, whether it be playing with children or grandchildren, walking, even housework. Incontinence caused 46% of women to change their lifestyle, which meant that they traveled less, they socialized less, they avoided things that they were not familiar with so that they could make sure that they weren't encountering possibly embarrassing situations. And 50% of women with urinary incontinence would call their condition a major problem and always bothersome. So it's significant. It's a significant problem. And as the baby boomers get older, this problem's only going to come more to the surface. So I think before we can talk about what the problems with the bladder are, I think we just have to kind of explain how the normal bladder is supposed to be working. So your bladder is a sac. It's shaped like a balloon. And there are muscles surrounding the bladder. This muscle here is called the detrusor muscle. There is also a sphincter muscle. Now, when the bladder is in a situation that you're at rest, whether you guys are all sitting here right now, your bladders should be allowing filling to occur. And not until you actually want to get up and go to the bathroom, and actually sitting down to go to the bathroom, should a contraction in this bladder muscle occur to cause it to empty. Okay? The sphincter muscle That's the muscle that you have which you control your loss of urine, or you control your urge. So if you have an urge to go and you tighten that muscle, that's the sphincter muscle that you're tightening. The larger muscle, the detrusor muscle, which you'll see, is not something that you can control. It's controlled by nerves that come to it from the brain and from the spinal cord. So as you can see, you've got the sphincter muscles here that act like kind of a rubber band that keep the contents of the bladder in the bladder. And they keep the urethra closed by squeezing. Pelvic floor muscles are under the bladder, and they help keep the urethra closed as well. What should be happening is there are small receptors all along the bladder wall that constantly give your brain information as to how full the bladder is. So we all can be aware that there is urine in the bladder. I might have urine in my bladder right now, but my brain is telling my bladder, don't contract, you're sitting in front of 80 people. Allow filling to occur. Okay? So filling will occur, and this muscle will continually stay relaxed. Now, after this talk, nerves are gone, I might want to go to the bathroom. When I get to the bathroom, my brain should be telling my bladder muscle, okay, he's in the bathroom, go ahead, do your thing. So when I finally get there and am ready to go, a message comes down to this muscle and says, squeeze. So the bladder will squeeze. I will let go of the muscle that I'm in control of, which is my sphincter muscle, and I will void. And that is how it's supposed to work. Now, we have many places along this pathway where things can go wrong, and it's our job to figure out what is going wrong and how then do we fix it. Okay? So bladder control means that you urinate only when you want to. And for good bladder control, all parts of your system must work together. The pelvic floors must hold up, muscles must hold up the bladder and the urethra. The sphincters must open and shut the urethra and keep urine inside the bladder. And the nerves must control the muscles of the bladder and the pelvic floor. All of that must work. So urinary incontinence is defined as the accidental loss or unwanted loss of urine, or just urinating when you don't want to. When we talk about incontinence, we separate incontinence into three main types. Stress incontinence occurs when pelvic muscles have been damaged. They cause the bladder neck to leak during exercise or coughing or sneezing or any type of activity that results from an increase in intra-abdominal pressure. So if I jump down, up and down like this, I'm putting pressure on my bladder. If something like that, even if I bend over, if I lift something heavy, I'm exerting myself and I'm transferring that pressure right down into my bladder, and if I lose urine, that's called stress urinary incontinence. Okay, so that's a very important distinction when you're thinking about your own situation, is to try to put a label on it and decide, well, what really makes me lose urine? Is it when I cough or sneeze, if I play tennis or golf? Those are things that are associated with stress incontinence. Now, urgency incontinence is the urgent need to pass urine and the inability to get to the toilet on time. It occurs when nerve passages along the pathway to the bladder to the brain are damaged, causing the bladder to contract. So, if we go back to our picture of the bladder muscle, what we're talking about with urge incontinence is exactly that. You get an urge to go to the bathroom, and instead of having 3 or 4 minutes to get to the bathroom, all of a sudden, if you don't get to the bathroom within the next 20 seconds, you're going to lose it. So I typically will hear that, I was absolutely fine, I was getting out of my car, I put my key in the door, and oh my God, if I all of a sudden had to go to the bathroom so badly that I lost urine on the way to the toilet. That is urgency-related incontinence. That occurs because this muscle, which is only supposed to contract When you're actually sitting on the toilet and wanting to go, something happens to make that muscle contract when you're not on the toilet. So what happens is you get a tremendous increase in pressure, and that overcomes your sphincter's ability to hold the urine in, and you lose urine. Okay, so that's a very important distinction when we're taking a history and we're trying to decide what type of problem do you actually have. Now, in a lot of women, it's not so easy to decide that because they actually have elements of both. And that's called mixed incontinence. It's both. You lose it with your coughing and sneezing, but you also lose it when you're trying to hold it while you're trying to get to the bathroom. A lot of times that starts at night. You get an urge to go, you can't get to the bathroom quickly in the middle of the night, and you lose urine on the way to the toilet. And then finally, probably the least common type of incontinence, but definitely the most difficult to treat, is overflow incontinence. And that occurs because the bladder muscle, that detrusor muscle that's contracting to cause the bladder to empty, is not functioning or it's stretched out, and the bladder just basically continues to fill and just overflows. And that's a very difficult type of problem to treat. Oftentimes it's women that have spent their lives as flight attendants, teachers, nurses, people that can't always go to the bathroom. So they've prided themselves throughout their career that they're a, quote, camel. You know, they can hold the urine for 8 hours at a time. Well, not so good. That's not such a good thing to do, because ultimately it can stretch your bladder to the point where those muscles are not functional. When we talk about what causes this, why does this happen? There's a lot of reasons it happens. Why does it happen to women, some women who've only had one child or no children, and why has it not happened to women that have had 7 or 8 children? Well, it's because the reasons are multifactorial. One of the most common denominators is postmenopausal changes. Levels of estrogen in the body decrease so that the support in the vagina becomes less. And we know that as women get older and they lose estrogen, they also may lose support for the pelvic floor muscles in the vagina, and you can have urethral hypermobility, meaning that the urethra itself is less supported, so when you put stress on it, it moves more. And the decreased muscle tone that's associated with menopause can definitely be a factor in why stress incontinence seems to occur as we get older. But other reasons are obesity, chronic conditions such as coughing, chronic coughs, COPD, asthma, chronic constipation is another one. There are all kinds of disease states that are associated with this, such as poorly controlled diabetes. So there are a number of health problems that can significantly affect how your bladder functions. Going to the bathroom every 3 hours while you're awake is probably normal, 3 to 4 hours. If you're going more frequently than that, but you drink 64 ounces of water during the day, well, as long as there's a good volume to your urine, in other words, you're not rushing to the bathroom only to find out, my God, I can't believe I had to go so badly, there wasn't that much there. If you're making a lot of urine because you're drinking a lot of fluids, then that's appropriate. At night, I think, looking at this audience, I think it's appropriate to wake up once, possibly even twice a night, depending on how long your night is. If you're going to bed at 9 o'clock in the morning and getting up at 7, you're going to go a couple times. But if you're going to bed at midnight and getting up at 6, then I think one time is probably appropriate. I think 64 ounces of water is appropriate, but let's not forget you're also drinking other things. So I think if you're trying to be hydrated, if you're really trying to make sure you're well hydrated, look at the color of your urine. That's a clue. If your urine's very clear, then probably you're overhydrated. If it's dark, then you're probably not hydrating enough. I would tell you that's where voiding diaries come in. Okay? Voiding diary are basically you're logging your voiding habits. Write down the time. Write down, I like to have patients measure actually how much they void. We give them something that they can put in the toilet and measure the volume. Because a normal void should have 6 ounces or more. Okay? Normally your bladder volume, your bladder holds about 9 ounces. Or even sometimes 15 ounces, 9 to 15 ounces. And when you're done voiding, there's always a little bit left, a residual we call it. And that residual should be less than 3 ounces. So we should see a void of somewhere around 9, 10, 11, 12 ounces. If you're not voiding that much, but you're going frequently, then chances are you have an overactive bladder. And that it's that muscle that's just overactive. Now, a lot of women, when they have this problem, do exactly what Valerie alluded to, which is defensively empty their bladder. I mean, I know this is true for most people here, where you say to yourself, I went to the bathroom 40 minutes ago, but I'm leaving the house now. I'm not sure when I'm going to have another bathroom, so I'm going to go again. Who does that? Okay. I do it too. But I'm going to tell you, it's absolutely the wrong thing to do. Because what you are doing is you're training the bladder, which has receptors in it, to tell you that you're full when you're not full, because you keep sitting down and asking that muscle to contract when your bladder isn't full. So you're training it to do that. So the first thing I would tell you is stop doing that. Now, I realize that life is life, and you cannot make your life so that you're going to enter possibly embarrassing situations. So the better way to handle that situation is to say, you know what, I go to the bathroom right now, but I'm leaving the house in 45 minutes, so I'm going to hold it till right before I go, and I'll go then. And don't go now and then. That will help train that bladder to hold more. I'm saying exactly that. You got it. You learned. You listened. Because that's true. You can empty your bladder too frequently, and you can empty your bladder not frequently enough. There is a happy medium. It's not more is better. You hold your urine, a teacher or a nurse that holds your urine for 8 and 10 hours, she's going to increase that bladder capacity from 15 ounces to 30 ounces. Well, that's going to stretch that muscle out so that when it contracts, it's very ineffective. It's so stretched out, it doesn't have any contraction strength. That's another kind of problem. So, yeah, that's why I tell patients that come to see me, I want you to empty your bladder every 3 to 4 hours, even if you don't feel the urge, because those patients need to start emptying their bladder more frequently. So it's not one size fits all. But if you're going every hour or 2 hours and you're trying to sit down and go, because you don't want to have to go when you're, in line for the bus or whatever you're doing, that can be a problem because you're training your bladder to contract more frequently. Do you understand? Okay. Well, nothing's just in your head. Okay, because your head is connected to the rest of you. So if they mean that, I think that there is a strong behavioral component to it. Now, you all remember Pavlov's dogs, right? That experiment that they did, we all learned about when we were in high school, where they rang a bell and they gave the dog a piece of steak, right? And pretty soon, just ringing the bell made the dog salivate. Well, the same thing happens with voiding.
So that if you are accustomed to doing something, like putting your key in the door when you get home and then going to the bathroom, pretty soon, just the act of putting the key in the door, your brain will kind of look at that as a sign that you're actually in the bathroom, and it'll jump the gun a little bit and send a message down to your bladder to contract. And that's why that occurs. Okay? Same thing can happen if you're washing dishes in the water, the running water. Well, that reminds you, oh, you know, I've got to go to the bathroom. I mean, one of my biggest problems when I'm in surgery is when I'm emptying someone's bladder and I'm watching the urine come out. I didn't have to go a minute ago, and I got to tell myself that's just my brain. I got to turn it off, you know. But that absolutely happened. I think that's what you might be referring to. I don't think that those patients are prone to stress incontinence, but I do think they're prone to problems with urgency, primarily because you can develop a chronic inflammatory condition in the bladder that causes the wall of the bladder to be irritated and constantly contract. So if you have a problem with, you know, chronic urinary tract infections, you may have some underlying chronic interstitial cystitis or some other reason for why you're getting those infections.